Did people in the Middle Ages just let their teeth rot and fall out? It's a common image. It's a peasant with a few blackened stumps, a knight with breath that could knock over a horse. And sure, a lot of that happened. But it's not the whole story. They didn't have fluoride or electric toothbrushes, but they did have ideas about how to keep their mouths clean. Some of them were smart, some were strange, and some were just plain dangerous. They worried about the same things we do. White teeth, fresh breath, no pain. Their solutions, though, came from a world without microscopes where magic, religion, and observation all mixed together. They thought toothaches were caused by a tiny worm gnawing at the root. They believed the moon could make your gums bleed. So how do they fight back? With things from the garden, the kitchen, the fireplace, and even the chamber pot. It's a look into a time when the human body was still a deep mystery, and a toothache could be a life-threatening event. Number 16, would you rinse your mouth with someone else's pee? It sounds like a joke, or maybe a dare. But for a very long time, using urine as a mouthwash was a real thing, and people took it seriously. This wasn't a medieval invention. It was an idea they inherited from the Romans. The Roman poet Catullus mocked a rival for having teeth that were too white, suggesting he must be using his own country's specialty, which was urine. Pliny the Elder, a Roman writer and naturalist from the 1st century, wrote about it in his massive work, Natural History. He specifically mentioned that stale, old urine was considered the most potent. The idea was that it had whitening power, and this belief didn't just vanish when Rome fell. It lingered in folk medicine for centuries. So why would anyone do this? They were observing something real, even if they didn't understand the science. Urine contains a compound called urea. When urine sits for a while and is exposed to bacteria in the air, the urea breaks down into ammonia. Ammonia is a powerful cleaning agent. It's a base, which means it has a high pH. This property helps it break down acidic stains on teeth, like those from wine or certain foods. It's also effective at cutting through grime and plaque. Think about the strong smell of smelling salts or some heavy-duty floor cleaners. That's ammonia. So when medieval people used stale urine, they were essentially swishing with a low-grade chemical cleanser. It probably did whiten their teeth to some extent. The practice wasn't universal, but it was known. It would have been more common in places where Roman influence was strong or where old medical texts were preserved in monasteries. The actual process was simple and grim. You'd collect urine, let it sit for a few days or even weeks to ferment, and then take a swig, swish it around, and spit it out. The taste and smell must have been horrific, but if you were a wealthy noble desperate for a bright smile, you might have been willing to try it. There are even accounts of urine being sold for this and other cleaning purposes like laundering clothes. The most prized stuff was sometimes imported because diet was thought to affect its quality. The scary part is what else they were doing to their mouths. Ammonia is corrosive. Rinsing with it regularly would have irritated the soft tissues of the gums, cheeks, and tongue. It could cause chemical burns and sores. It could also damage the tooth enamel over time, making teeth weaker and more prone to decay, even as it made them look whiter in the short term. They were trading long-term health for a short-term cosmetic effect. They had no concept of enamel erosion or the mouth's delicate microbiome. They just saw a stain and they used a strong substance to remove it. It's easy to laugh, but the core idea hasn't completely vanished. Modern chemistry just refined it. Some professional teeth whitening products use a compound called carbamide peroxide. Guess what? Carbamide peroxide breaks down into hydrogen peroxide and urea. That's right, the same core component found in urine. We just found a much safer, more effective, and far less disgusting way to deliver it. We isolated the active ingredient and removed all the other stuff. It shows that ancient people weren't always stupid. They were just working with the limited tools and knowledge they had. They saw a cause and an effect and they ran with it. But what don't we know? How widespread was this practice really? Or was it just something a few writers mentioned? Did people develop chronic mouth sores or gum diseases from this? And would we even be able to tell by looking at their skeletons? And what about the psychological barrier? How desperate did someone have to be to decide that this was a good idea? Number 15, could a burnt piece of toast really clean your teeth? Imagine waking up going to the fireplace and grabbing a piece of soot-covered charcoal. Then you take a damp cloth, dip it in the black powder, and start rubbing it all over your teeth. This was a common form of toothpaste in the Middle Ages. It wasn't just charcoal. People made tooth powders out of all sorts of things they could find. They burned bread until it was a black crisp and crushed it. They ground up rosemary stems into a powder. They even burned the heads of hares or the bones of mice and mixed the ash with other ingredients. The goal was always the same: to find something gritty that could scrub the teeth clean. The logic was simple and mechanical. They knew that a film, what we call plaque, built up on their teeth, and they knew that rubbing it with something abrasive could scrape it off. It's the same principle as using sand to scrub a dirty pot. A simple linen or wool cloth by itself could do a decent job, but adding a powder made it much more effective. Salt was another popular choice. It was abrasive, and as they might have noticed from using it to preserve meat, it seemed to have some cleaning or purifying properties. So they'd take a finger or a cloth, dip it in salt, and scrub away. This method was surprisingly effective, up to a point. The abrasive powders, like charcoal or salt, were very good at removing plaque and surface stains. People who did this regularly might have had teeth that looked quite clean and white. Archaeologists have studied the teeth of medieval skeletons, and what they've found is often surprising. For example, a 2013 study of skeletons from a medieval cemetery in Dalmatia, Croatia, found that many individuals had remarkably little plaque buildup compared to modern populations. Their abrasive diet helped, but practices like this likely played a role too. Using a cloth was also gentler on the gums than a hard bristled brush might have been, reducing the risk of gum recession. But there was a huge downside. The abrasiveness was a double-edged sword. While it removed plaque, it also wore away the tooth enamel. Enamel is the hard protective outer layer of the tooth. Once it's gone, it doesn't grow back. The powders they used were completely unregulated in terms of grit size. Some batches might have been fine, but others could have been as coarse as sand. Using a harsh abrasive every day would slowly grind down the enamel, exposing the softer dentin underneath. This would make the teeth more sensitive, more yellow in color, and much more vulnerable to cavities. So while they were fighting plaque, they were accidentally weakening their teeth's main defense. Famous medical texts from the period mention these practices. The Trotula, a collection of texts on women's medicine from the 11th or 12th century in Salerno, Italy, includes recipes for tooth powders and whiteners. One recipe suggests a mix of ingredients including burnt date pits and white marble. Another prominent figure, Guy de Chauliac, a 14th century French physician and surgeon often called the father of surgery, wrote about dental care in his influential book, Chirurgia Magna. And he recommended that people avoid things that could corrupt the teeth and suggested cleaning them with a mixture of wine and specific spices. He and others understood the need for cleaning, but their chemistry was a guessing game. So here we are in the 21st century, and what's a popular trend in natural toothpaste? Charcoal. The idea has come full circle. Modern charcoal toothpastes are, of course, processed to have a much finer and safer particle size. But the American Dental Association still advises caution, stating there's no evidence it's better and that its long-term effects on enamel are not well understood. We are still grappling with the same question they were: how do you clean teeth effectively without damaging them? This leaves us with some unsettling questions. How much enamel damage did the average medieval person who used these powders actually have? Could we use modern technology to scan their teeth and measure the microscopic scratches left by these ancient cleaning methods? And did they notice their teeth becoming more sensitive over time? And if so, did they connect it to their abrasive cleaning habits, or just assume it was a normal part of aging? Number 14, was chewing on a stick better than using a toothbrush? Before toothbrushes with neat little bristles, there was the chew stick. This is one of the oldest dental tools in human history, with use dating back thousands of years to ancient Babylon and Egypt. And it was still very much in use during the Middle Ages across Europe, Africa, and the Middle East. The idea was simple. You take a twig from a specific type of tree, chew on one end until the fibers separated and formed a primitive brush, and then use that end to scrub your teeth. The other end could be sharpened to a point to be used as a toothpick. It was an all-in-one dental tool provided by nature. The choice of wood was important. It wasn't just any random stick. People learned through trial and error which trees had the best properties. In the Middle East and Africa, the most popular choice was the Salvadora persica tree, which produces a stick known as a miswak. The miswak is so effective that its use is even encouraged in Islamic texts for ritual purification. In Europe, people might have used twigs from oak, birch, or trees in the dogwood family. And, they were looking for wood that was fibrous, but not too soft, and ideally had a pleasant taste or some medicinal benefit. Modern science has actually studied these chew sticks, especially the miswak, and the results are fascinating. A 2003 study published in the Journal of Contemporary Dental Practice compared the effectiveness of the miswak to a conventional toothbrush. It found that for reducing plaque and gingivitis, the miswak was at least as effective, and in some measures, more effective than the toothbrush. This is because the sticks aren't just mechanical cleaners. The wood itself contains naturally occurring chemical compounds. The Salvadora persica, for example, contains silica, which is an abrasive tannins, which are astringents that can reduce gum inflammation and various antibacterial compounds that can kill the germs that cause plaque and bad breath. It's literally a toothbrush and toothpaste in one stick. So, a medieval person chewing on the right kind of stick might have been getting a surprisingly good cleaning. They were physically removing food particles and plaque with the frayed bristles. They were stimulating their gums, which is good for circulation, and they were delivering low doses of natural antimicrobial agents directly to their teeth and gums. This was a far cry from just letting food rot in your mouth. It was an active and in many ways scientifically sound method of oral hygiene. It was cheap, it was portable, and it was effective. The problem was consistency and knowledge. Not everyone would have known which sticks to use. Someone using a twig from a toxic plant, like you, could make themselves sick. Someone using a wood that was too hard could damage their gums or enamel. The effectiveness also depended on technique. You had to chew the end just right to get a good brush and then be methodical in cleaning all the surfaces of your teeth. It was a skill passed down through generations. In Europe, as the Middle Ages progressed, the use of chew sticks seems to have become less common among the upper classes compared to using a cloth with powder, but it likely persisted among rural populations. Today, chew sticks are still used by hundreds of millions of people around the world. You can buy packaged miswak sticks online, and the principles behind them are showing up in our modern products. We extract chemicals from plants like mint, tea tree, and neem for our toothpastes and mouthwashes because of their natural antibacterial properties. We are, in a way, just deconstructing the chew stick and putting its components into a tube. But this ancient practice raises new questions. What other plants, forgotten by modern science, were used as chew sticks in medieval Europe, and what unique chemical properties did they have? Could a systematic study of these forgotten toothbrushes lead to the discovery of new natural compounds for fighting dental disease? And if the chew stick is so effective, why did it fall out of favor in the West? Was it simply a matter of fashion, or were there other practical reasons we no longer understand? Number 13, could a dead person's tooth cure your toothache? When pain becomes unbearable, people will try anything, and a toothache in the Middle Ages could be an agonizing, relentless torment. With no modern painkillers or effective dental treatments, suffering could go on for weeks. In that desperation, people turned to magic, superstition, and religion. They believed the world was full of unseen forces, and a toothache wasn't just a physical problem. It could be a punishment from God, a curse from a witch, or an imbalance in the body's humors. So the cures had to fight on those same supernatural battlefields. One of the strangest and most morbid cures was the use of sympathetic magic. This was the belief that an object with a connection to a person or a problem could be used to influence it. For a toothache, this meant finding a tooth from someone else, preferably from a dead person in a graveyard. The idea was that the pain could be transferred to the dead tooth. Another variation involved touching the aching tooth with the finger of a dead man. The cold, lifeless touch was thought to kill the pain. These weren't just fringe beliefs. They were part of a widely accepted worldview where the physical and spiritual were deeply intertwined. Spells and charms were also incredibly common. You might be told to write a specific prayer or a series of magical words on a piece of parchment and wear it as an amulet. Or you might have to write it on a piece of bread and then eat the bread, hoping to internalize the cure. One popular charm involved reciting a prayer to Saint Apollonia. She was a Christian martyr from the 3rd century whose teeth were shattered by her persecutors. Because of the nature of her suffering, she became the patron saint of dentistry and those with toothaches. People would pray to her, light candles in her name, and believe that her divine intervention could ease their pain. The famous abbess, physician, and mystic Hildegard of Bingen writing in the 12th century, offered her own unique remedies that mixed practical herbalism with spiritual concepts. For a toothache, she suggested warming a piece of a pear tree on a fire, holding it to the aching cheek, and saying a specific prayer, invoking God to cast out the worm, causing the pain. This brings up another core medieval belief, the tooth worm. For thousands of years, people believed that a tiny worm lived in the tooth and that its wriggling and gnawing caused the intense pain of a toothache. This theory, which may have originated in ancient Mesopotamia, made intuitive sense. The pain felt like something was alive and moving in there. Many cures were therefore aimed at killing or expelling this imaginary worm. From a modern perspective, these magical cures had one powerful, undeniable effect, the placebo effect. When a person truly believes a treatment will work, their brain can release endorphins, which are natural pain-relieving chemicals. The ritual of a prayer, the comfort of a charm, or the sheer psychological shock of a graveyard remedy could be enough to temporarily reduce the perception of pain. It didn't fix the underlying infection or decay, but it could provide a few hours or even days of relief. In a world without aspirin, that was a miracle. The social aspect was also important, as having a healer or a priest perform a ritual showed that the community cared, which can have a powerful effect on a person's ability to cope with pain. The tooth worm theory, while wrong, led to some treatments that appeared to work. One common practice was fumigation. The sufferer would inhale the smoke from burning henbane seeds. Henbane is a plant in the nightshade family that contains scopolamine and hyoscyamine. These are powerful hallucinogenic and narcotic compounds. The fumes would certainly dull the pain by drugging the patient. But there was a theatrical trick too. When henbane seeds are heated on a hot coal, the tiny embryos inside pop out, and they look like small, writhing worms. A clever practitioner would have the patient spit into a bowl of water after the fumigation and would secretly add some preheated seeds. The patient would see the worms in their spit and believe they had been expelled. They were drugged, and they were convinced the cause of their pain was gone. A potent combination. But it makes you wonder how much of medicine, even today, relies on the patient's belief in the cure. If we could measure the brain activity of a medieval person using a charm versus a modern person taking a placebo pill, how similar would they look? And were there healers who genuinely believed in the magic, and others who knew it was a trick but saw it as a necessary tool to help people manage their suffering? Number 12. Why was wine the mouthwash of choice? If you were a wealthy person in the Middle Ages, you might start and end your day with a swish of wine. It wasn't just for drinking. Wine was considered a sophisticated and healthy mouth rinse. It was thought to clean the teeth, strengthen the gums, and perfume the breath. This wasn't seen as an indulgence, it was part of a prescribed health regimen. Medical texts from the period, including those by prominent physicians like Guy de Chauliac, recommended rinsing the mouth with wine. Sometimes it would be plain wine, and other times it would be infused with herbs and spices like cinnamon, cloves, or mint to make it more potent and pleasant. Their reasoning was based on the theory of humors, the idea that the body was governed by four fluids: blood, phlegm, yellow bile, and black bile. Health was a matter of keeping these humors in balance. Wine, especially red wine, was considered hot and dry. It was thought to counteract the cold and moist conditions in the mouth that led to decay and bad breath. It was also seen as a general disinfectant. People knew that wine could be used to clean wounds to prevent infection, a practice that dated back to the ancient Greeks. The surgeon Henri de Mondeville, who died in 1320, was a strong advocate for using wine on wounds. So, it made logical sense to apply the same thinking to the mouth, which could be full of sores and decay. And they were not entirely wrong. Wine does have properties that can kill oral bacteria. First, there's the alcohol. The alcohol content in medieval wine was often lower than today's, but it was still present and has antiseptic qualities. Second, and more importantly, is the acidity. Wine is acidic, primarily due to tartaric acid and malic acid. This low pH environment is hostile to many of the bacteria that cause plaque and gum disease, like Streptococcus mutans. A 2007 study from the University of Pavia in Italy found that both red and white wine showed distinct antibacterial activity against Streptococcus. So a daily wine rinse could have actually helped to reduce the bacterial load in the mouth. The added herbs would have boosted this effect. Many of the spices they use, like cloves and cinnamon, contain powerful natural antimicrobial compounds. A clove, for instance, contains eugenol, a substance still used in dentistry today for its antiseptic and analgesic pain-killing properties. A wine infused with these spices would have been a fairly effective multi-pronged attack on oral germs. It would clean, disinfect, and leave the breath smelling of something other than rotting food. But just like the abrasive powders, this remedy had a serious hidden flaw. The same acidity that killed bacteria also erodes tooth enamel. Enamel is a mineral and it dissolves in acid. Swishing with an acidic liquid like wine every day, especially if you then scrubbed your teeth with an abrasive cloth, would be a recipe for disaster in the long run. It would strip away the enamel, leaving the teeth weak, sensitive, and prone to cavities. The sugar content in some of the sweeter wines would have also been a problem, feeding the very bacteria they were trying to kill. They were essentially caught in a trap. The thing that seemed to be cleaning their mouth was also slowly destroying their teeth. This highlights the trial and error nature of medieval medicine. They could observe short-term effects. Rinsing with wine made their mouth feel cleaner. It might have temporarily soothed sore gums. They had no way of seeing the slow microscopic damage happening to their enamel. They couldn't run a 20-year longitudinal study. All they had was immediate results and ancient theories. And based on that, wine mouthwash seemed like a great idea. This ancient practice forces us to look at our own habits. We drink acidic beverages like soda, juice, and coffee all day long. How different is that from a medieval wine rinse in terms of its effect on our enamel? Have we studied the long-term combined effect of modern acidic diets and abrasive toothpastes? And could there be a way to harness the antibacterial properties of wine's compounds without the damaging effects of its acidity, creating a truly new kind of mouthwash? Number 11. Could you really tie your teeth together to keep them in place? Picture this: one of your front teeth becomes loose, maybe from an injury or maybe from advanced gum disease. Every time you bite down, it wiggles. It's painful, and you're terrified it's going to fall out. In the Middle Ages, there was no way to save the tooth with a root canal or a crown. But a skilled barber surgeon might offer you a solution. He could splint the tooth. Using a fine thread, often made of silk or gold wire, he would carefully lace the loose tooth to its stable neighbors on either side. That was a delicate, intricate procedure, essentially tying your teeth together to hold the weak one in place. This technique, known as dental ligation, wasn't a medieval invention. It has a surprisingly long history. Archaeologists have found examples of it in ancient Egyptian mummies, and among the Etruscans in Italy from as early as 700 BC. The knowledge was preserved and passed down through Greek, Roman, and then Arabic medical texts, which were hugely influential in medieval Europe. The great Islamic physician Abulcasis, who lived in Spain in the 10th century, described the procedure in detail in his Encyclopedia of Surgery, the Al-Tasrif. He recommended using gold wire because it was malleable and didn't tarnish. His work was translated into Latin and became a standard textbook for European surgeons for hundreds of years. The goal was to stabilize the tooth to allow the ligaments and bone around it to heal, hopefully re-anchoring the tooth in its socket. If the looseness was due to a traumatic injury, this could sometimes work. If the bone and ligaments weren't too badly damaged, immobilizing the tooth could give them a chance to repair, much like setting a broken bone in a cast. The surgeon would have to be very skilled, weaving the wire or thread around the teeth carefully to get a firm hold without causing more damage. For a wealthy client, using gold wire was also a status symbol, a visible sign that you could afford the very best and most advanced medical care. However, in the vast majority of cases, the tooth was loose because of severe periodontal gum disease. This is a chronic infection that destroys the bone and tissues that support the teeth. In this situation, splinting was a temporary fix at best. It didn't treat the underlying infection. In fact, it often made it worse. The wires and threads created new places for plaque and food debris to get trapped. It would have been nearly impossible to clean around these splints. This would lead to more inflammation and infection, accelerating the bone loss around not just the loose tooth, but its healthy neighbors as well. The splint, meant to save one tooth, could end up condemning 3. The patient would get some short-term relief. The tooth would feel more stable and they could eat more comfortably, but underneath the wire, the disease would continue its silent destruction. Eventually, the anchor teeth would also become loose, and the entire splinted section might fall out as one unit. Without an understanding of germ theory, and the real cause of gum disease, the barber surgeons were fighting a battle they couldn't win. They were treating a symptom, the loose tooth, without understanding the disease. It was a masterpiece of mechanical ingenuity applied to a biological problem they didn't grasp. Today, we still use a modern version of this technique called periodontal splinting, but it's done in a completely different context. First, we treat the underlying gum disease with deep cleaning and sometimes surgery. Only when the infection is under control might a dentist bond the loose tooth to its neighbors using tooth-colored composite resin. It's a last-ditch effort to get a few more years out of a compromised tooth. We're working with the biology, not against it. The medieval surgeon was just working with wire. This raises some fascinating questions. When archaeologists find an ancient skull with dental ligation, can they determine the cause of the tooth looseness? Can they analyze the preserved plaque around the wires to see what kind of bacteria were thriving there? And how did the patients feel about this? Was it seen as a cutting-edge miracle of medicine, or a desperate, painful procedure that rarely worked in the long run? Number 10, how did they fill a cavity without a drill? The idea of drilling out decay and putting in a filling seems like a modern invention. But people in the Middle Ages also tried to patch up holes in their teeth. They didn't have high-speed drills or sophisticated composite resins, but they did have a need to plug cavities that were trapping food and causing pain. The process was done by hand, and it was probably excruciating. A barber surgeon or a specialized tooth drawer would use a set of small, sharp hand tools, like picks and scrapers, to manually dig out the soft, decayed parts of the tooth. There was no anesthetic, of course. The patient would just have to endure it, maybe after a large drink of wine or a dose of an opium-based potion. The goal was to remove as much of the putrefaction as possible. Once the cavity was cleaned out, it needed to be filled with something. The materials they used were varied and resourceful. They might use beeswax, which was soft and could be easily packed into the hole. They might use resins from trees like frankincense or mastic. These materials were sticky and had the added benefit of having some mild antibacterial properties. For more durable fillings, they might use a powder made from ground-up minerals or bone, mixed with a binder like honey or resin to form a paste. The great French surgeon Guy de Chauliac wrote about this in the 14th century. He suggested filling cavities to prevent them from breaking apart. Some practitioners even used lead or gold foil. They would take small, thin sheets of the metal and painstakingly pack them into the cavity, bit by bit, until it was full. This was a technique that had been around since the Romans and was practiced by the most skilled surgeons on their wealthiest clients. And a gold filling was a huge status symbol. How effective were these fillings? It's a mixed bag. A simple wax or resin filling would probably only last for a short time. It would wear down quickly and could easily fall out. However, it would serve a valuable purpose in the short term. It would seal the hole, keeping food out and reducing the sensitivity and pain. This could make eating much more comfortable and might slow down the decay process. It bought the patient some time. The metal fillings, if done well, could be more permanent. But the process was incredibly difficult. Without a modern drill to create a clean, well-shaped cavity, it was hard to get the filling to stay in. There was also the problem of leakage. If the filling didn't seal the cavity perfectly, bacteria and food particles could seep in around the edges, causing new decay to start underneath the filling. This is a problem even modern dentists have to worry about, and it would have been a massive issue with medieval techniques. Furthermore, they didn't remove all the decay, they just scraped out the softest parts. The infected dentin left behind would continue to decay under the filling, leading to the death of the tooth's nerve and a painful abscess. And archaeological evidence for this is rare, but revealing. The skull of a man found in Denmark, dating to around 1300 AD, showed evidence of a cavity being prepared, possibly for a filling, with hand tools. Another find, the Lopi skeleton from Scotland, dating to the mid-17th century, but reflecting much older practices, had a cavity in a molar packed with gold foil. These finds show that while it wasn't common, the idea of restorative dentistry did exist. It was reserved for the rich and performed by the most skilled practitioners. For most people, a cavity simply meant a slow, painful journey toward the tooth breaking apart and needing to be pulled. So we have to ask, who were these highly skilled individuals who could perform such a delicate procedure? Were they a specialized subset of surgeons, or was this a closely guarded secret of a few masters? How did they develop their tools and techniques without any formal schools or research. And when a filling failed and caused a massive abscess, was the surgeon blamed, or was it just seen as an unavoidable act of God? Number 9. What did they do when a toothache was so bad? You wished you were dead? Today, if you have a severe toothache from an infected nerve, you get a root canal. A dentist painlessly removes the nerve, cleans out the tooth, and seals it. In the Middle Ages, the pain from an infected nerve, or pulpitis, was a special kind of hell. It was a throbbing, relentless agony that could drive a person mad. They believed it was the tooth worm at its most active. They needed to kill the nerve to stop the pain, and they had a method for it. It was brutal, direct, and terrifying cauterization. A barber surgeon would take a long, thin metal rod, like a needle or a probe, and heat it in a fire until it was red hot. The patient would be held down, their mouth forced open. The surgeon would then take the glowing hot probe and insert it directly into the cavity of the tooth until it touched the living pulp, the nerve. The idea was to burn the nerve to death. The sizzle, the smell of burning tissue, and the searing flash of pain would have been unimaginable. But if it worked, the constant throbbing ache would be replaced by the pain of the burn, which might eventually subside. By killing the nerve, they had cured the toothache. This was a procedure of last resort, performed when all other remedies like herbs and charms had failed. It was described in medical texts of the time. The Islamic physician Abil Qasis described cautery for a variety of ailments, and the practice was adopted by European surgeons. They used it not just for teeth, but for treating wounds, stopping bleeding, and removing tumors. They believed that the intense heat had a purifying effect, burning away the bad humors or the sickness itself. In the case of a tooth, they were literally fighting fire with fire. The problem is that the tooth was now dead. It was a hollow shell filled with dead, burned tissue. This created the perfect environment for a bacterial infection. Without any way to clean out and seal the inside of the tooth, it would quickly become a breeding ground for germs. The dead nerve tissue would decompose, and a massive infection or abscess would form at the root of the tooth. This would cause a new and often much worse kind of pain. A large swelling would appear on the gum or face. The infection could spread to the jawbone, causing osteomyelitis, or even get into the bloodstream, leading to sepsis and death. The cure for the toothache could end up killing the patient. Even if the patient survived, the dead tooth would become brittle and discolored. It would eventually crumble and break or have to be extracted anyway. So cauterization was at best a temporary ticket out of one kind of pain in exchange for a high risk of a much more dangerous condition later on. It shows the sheer desperation of both the patient and the practitioner. They were willing to do something this extreme to stop the suffering. We still use heat in dentistry today, but in a totally controlled and precise way. During a root canal, a dentist might use a heated instrument to sear off the tip of the gutta percha, the rubbery material used to fill the canal. The lasers, which are a form of focused light and heat, can be used to disinfect canals or perform gum surgery. We've taken the raw, brutal concept of cautery and refined it into a microscopic, life-saving tool. This brutal practice leaves behind some haunting questions. How many people actually died from infections caused by this procedure? Skeletons can show evidence of abscesses, but can we tell which ones were caused by a failed cauterization? What was the psychological state of a surgeon who had to perform this procedure, inflicting such incredible pain in the hope of providing a cure? And did they ever make a connection between cauterizing a tooth and the abscess that often followed weeks or months later? Number 8. Who would you trust to pull your tooth? When a tooth was beyond saving, it had to come out. Extraction was the most common form of major dental surgery in the Middle Ages. But you didn't go to a university-trained physician for this. Physicians considered themselves intellectuals. They diagnosed illnesses, studied ancient texts, and prescribed medicines. They thought surgery, which involved blood and hands-on work, was beneath them. That messy business was left to the barber surgeons. As the name suggests, these practitioners were both barbers and surgeons. In a medieval town, the barber's shop was a place for a haircut, a shave, and maybe some minor surgery. This included bloodletting, a very common medical procedure, lancing boils, setting broken bones, and, of course, pulling teeth. They learned their trade through apprenticeship, not through formal schooling. A young boy would work for a master barber surgeon for years, learning by watching and doing. The best of them became highly skilled. The worst were butchers. Their primary tool for extraction was the dental pelican. Named because its shape resembled a pelican's beak, this was a fearsome-looking metal instrument. It had a shaft and a curved claw. The idea was to hook the claw under the crown of the tooth and use the shaft as a lever against the neighboring teeth or the jawbone. With a strong twist and pull, the tooth would hopefully pop out. It was a tool that relied on brute force. If used improperly, it could easily fracture the jaw, break the tooth off at the gum line, leaving the roots behind, or damage the adjacent teeth. There were other tools as well, like forceps of various shapes and sizes for gripping the tooth, and elevators for loosening it from its socket. A skilled tooth drawer would have a whole roll of these intimidating instruments. The procedure itself was a public spectacle. It might happen in the barber's shop, or even in the town square at a market or fair. A crowd would gather to watch the drama unfold. The dentist might have a drummer or a musician with him to help drown out the patient's screams. The patient would be given a lot of alcohol to drink, but there was no real anesthetic. It was a terrifying, painful, and dangerous experience. The risk of infection was enormous. The instruments were not sterilized. They would be wiped clean at best before being used on the next person. The open socket in the jaw was a gateway for bacteria. Many people suffered from serious post-extraction infections. If the tooth broke, the surgeon would have to try to dig out the remaining roots with sharp picks. This could drive infection deeper into the jawbone. People died from tooth extractions. A simple procedure today was a life-threatening event then. Despite the risks, the best barber surgeons were respected for their skill. Their figures, like the aforementioned Guy de Chauliac, and Henri de Mondeville wrote extensively about surgery, including detailed instructions for tooth extraction. They tried to make the process as scientific as possible, advising on the best techniques to avoid breaking the jaw. They represented the top tier of their profession. But for every one of them, there were dozens of traveling quacks and charlatans who would pull teeth with rusty pliers for a few coins, often causing more harm than good. The professions of barber and surgeon didn't officially separate in England until 1745, when King George II created the Company of Surgeons. This was a crucial step in turning surgery into the respected medical specialty it is today. But for the entire medieval period and beyond, the man who cut your hair was the same man you trusted to rip a diseased tooth out of your head. This system raises so many questions. How did a person decide which barber surgeon to trust? Was it just word of mouth? What was the actual success rate of extractions versus the rate of serious complications like jaw fracture or fatal infection? And can we look at medieval jaws and tell the difference between a good extraction and a bad one, perhaps seeing the telltale signs of a shattered jawbone that healed poorly? Number 7, could a special diet really prevent cavities? We think of cavities as a modern problem fueled by sugar, and that's largely true. But people in the Middle Ages got cavities too. The key difference was what they ate. Their diet was, in one very important way, much better for their teeth than ours is. The single biggest factor was the near total absence of refined sugar. Sugar, processed from sugarcane, was an incredibly rare and expensive luxury item. It was used more like a spice by the very wealthy. For the vast majority of the population, their diet contained almost no sucrose, the type of sugar that is the main food source for cavity-causing bacteria. So what did they eat? The diet of a typical peasant was based on coarse, stone-ground bread made from rye or barley, vegetable stews, pottage, cheese, eggs, and small amounts of meat or fish when they could get it. Their main sweeteners were honey and fruits, but these were seasonal and consumed in much smaller quantities than we eat sugar today. The bread was a key factor. The stone milling process left tiny, gritty particles of stone in the flour. This, combined with the rough, fibrous nature of the whole grains, meant that their bread was highly abrasive. Every time they ate, they were essentially scrubbing their teeth with this coarse food. It acted as a natural cleanser, scouring away plaque before it could do much damage. Archaeological evidence confirms this. Studies of medieval skeletons consistently show a much lower rate of dental caries cavities than in post-industrial populations. For example, a study of remains from a medieval parish in Warham, Percy, England, showed that only about 20% of the population had any cavities at all. Compare that to today, where cavities affect the vast majority of people at some point in their lives. However, the same studies show that their teeth were often worn down flat from the constant grinding on their gritty diet. This is called dental attrition. They traded cavities for severe wear. As their enamel wore away over the decades, the sensitive dentin underneath would be exposed, which could also be very painful. The wealthy elite had a different set of problems. They ate a much more refined diet. They could afford bread made from finely sifted wheat flour, which was less abrasive. And most importantly, they were the ones who had access to sugar. As trade routes expanded in the later Middle Ages, sugar became more available, and the rich began to consume it in desserts, drinks, and as a general sweetener. And with the rise of sugar came the rise of cavities. Queen Elizabeth I, who, lived just after the medieval period in the 16th century, was famously fond of sugar and had notoriously black decayed teeth as a result. She was a walking advertisement for the dangers of the new sweet substance. Medieval physicians understood the connection between diet and health, though their explanations were based on the theory of humors. They advised against certain foods that they believed created, but humors in the mouth and led to decay. They didn't know about bacteria or sugar, but they could observe that some people's teeth seemed to rot more than others, and they tried to connect it to what those people ate and drank. They often recommended ending a meal with something like cheese, which they believed would close the stomach and protect the teeth. We now know that cheese is non-acidic and stimulates saliva, which helps to neutralize acids in the mouth, so their observation was spot on, even if their reasoning was wrong. The story of the medieval diet is a perfect natural experiment. It shows us what happens to teeth in a low-sugar, high-abrasion environment versus a high-sugar, low-abrasion environment. It's a stark lesson in how dramatically our food choices impact our oral health. But it leaves us wondering, exactly how much wear did the average person have by the time they were 40? Was it painful? Can we analyze the microscopic wear patterns on their teeth to reconstruct their specific diets with even greater accuracy? And if they had lived as long as we do now, would that severe wear have eventually led to a whole different kind of dental crisis in old age, with teeth worn down to the gum line? Number 6. Could you use acid to dissolve stains off your teeth? The desire for pearly white teeth is not a modern obsession. In the Middle Ages, white teeth were a sign of beauty, youth, and high social status. People went to extreme lengths to get them. We've already seen how they used abrasive powders and urine. But for those who wanted faster, more dramatic results, there was a much more dangerous option: acid. Barbers, surgeons, and other practitioners offered a treatment that involved painting the teeth with a strong acid, often nitric acid, which they called aqua fortis, or strong water. And nitric acid was a substance well known to alchemists, who had been able to distill it since around the 9th century. They used it to dissolve metals, and it was a powerful and dangerous chemical. The dentist would apply a small amount of this acid to the patient's teeth with a small stick or brush. The acid would instantly get to work, dissolving the outer layer of the enamel. This would remove surface stains, plaque, and a thin layer of the tooth itself. The immediate result would be teeth that looked much whiter and cleaner. The patient would be thrilled. The problem was the catastrophic damage it caused. The acid didn't just remove stains, it etched and eroded the protective enamel, leaving it rough, pitted, and incredibly weak. A single application could do irreparable harm. Repeated applications would strip the enamel away completely, exposing the soft yellow dentin underneath. The patient's teeth would become incredibly sensitive to hot and cold, and worst of all, the rough and weakened surface was now a perfect place for new stains and plaque to stick. The teeth would soon become discolored again, often worse than before. They were also now massively susceptible to decay. This was the medieval equivalent of a dangerous fad beauty treatment. It promised a quick fix, but caused devastating long-term consequences. The practitioners themselves may not have fully understood the damage they were causing. They saw an immediate positive result and probably didn't connect it to the patient's severe dental problems months or years later. Or perhaps the more cynical ones knew the damage it caused, but also knew it would bring the customer back for more treatments when their teeth got stained again, creating a vicious cycle. The famous French surgeon Ambroise Paré, writing in the 16th century, warned against this practice. He saw firsthand the terrible damage caused by these tooth whiteners and advised people to avoid them. He understood that they were destroying the very substance of the teeth, but the allure of a quick cosmetic fix was powerful, and the practice likely continued. It was a painful lesson in the difference between appearance and health. In a strange way, we see echoes of this today. Modern professional teeth whitening uses chemicals like hydrogen peroxide or carbamide peroxide. These are also strong oxidizing agents, a type of chemical that can cause damage if misused. That's why the concentrations used in over-the-counter products are much lower than what a dentist uses in a controlled professional setting. People who overuse whitening strips or gels can experience severe tooth sensitivity and gum irritation. And there are still dangerous, unregulated whitening products sold online that can cause real harm. The temptation to use a powerful chemical for a quick cosmetic result is still with us. This leads to some disturbing questions. How many people in the Middle Ages effectively destroyed their own teeth in the pursuit of a whiter smile? Can we find archaeological evidence of this, such as teeth with the characteristic etching and erosion patterns caused by acid attacks? And was there a black market for these dangerous chemicals, with people trying to perform the treatment on themselves at home, with even more disastrous results? Number 5, were herbs the secret to fresh breath? Bad breath, or halitosis, was a major social concern in the Middle Ages, just as it is today. In a time before daily brushing and flossing, it was a constant battle. The causes were the same as they are now: food trapped between teeth, gum disease, tooth decay, and coatings on the tongue. Without effective ways to treat the root causes, people relied heavily on masking the smell. And for that, they turned to the garden. Herbs were the medieval equivalent of breath mints and mouthwash. People would chew on fresh herbs to release their aromatic oils and freshen their breath. The most popular choices were parsley, mint, and cloves. Chewing parsley after a meal was a common practice, especially after eating smelly foods like garlic. We now know that parsley contains chlorophyll, which can have a temporary deodorizing effect. Mint, with its strong, clean scent from menthol, was another favorite. It provided a powerful cooling sensation and a pleasant smell that could cover up other odors. Cloves were perhaps the most potent. They have a very strong, spicy aroma and taste. Chewing on a single clove could perfume the breath for a long time. But these herbs weren't just breath fresheners. Many of them had real medicinal properties. This is where medieval herbalism, based on centuries of observation, really showed. Clove, as we've seen, contains eugenol, a natural antiseptic and painkiller. Chewing a clove wouldn't just improve your breath, it would also help to kill oral bacteria and could temporarily numb the pain of a toothache. This is why the scent of cloves is so strongly associated with dentistry even today. Sage was another important herb. People would make a tea from sage leaves and use it as a mouth rinse. Modern studies have shown that sage has antibacterial, antifungal, and anti-inflammatory properties. Rinsing with a sage infusion could have genuinely helped to reduce gum inflammation and fight infection. Hildegard of Bingen, the 12th century German abbess, wrote extensively about the healing properties of plants in her book Physica. She recommended various herbal preparations for oral health. For example, she suggested holding warm wine in which yarrow had been cooked to soothe aching teeth. This combination of the wine's antiseptic properties and the yarrow's anti-inflammatory compounds would have provided real relief. This wasn't just superstition, it was a form of early pharmacology. People were using the natural chemical factories found in plants to treat their ailments. They also used spices to create breath-freshening candies or powders. A mixture of ground-up cloves, cinnamon, nutmeg, and a binder like honey or sugar for the rich could be formed into small comfits to be nibbled on throughout the day. These would have been the original breath mints. For the less wealthy, simply chewing on fennel or anise seeds was a common way to sweeten the breath. While these herbal remedies were excellent at masking bad breath and could have some therapeutic benefits, they couldn't solve the underlying problems. If you had a mouthful of rotting teeth and severe gum disease, chewing on mint would only help for a little while. It was a cosmetic solution to a deep-seated health issue, but in a world without other options, it was an essential tool for social interaction. It allowed people to get close enough to talk to each other without being overwhelmed by foul odors. It made life more pleasant. The legacy of medieval herbalism is all around us. Walk down the oral care aisle in any supermarket and you'll see toothpaste and mouthwashes flavored with mint, cinnamon, and fennel. You'll see products that advertise the benefits of tea tree oil, neem, or sage. We are still using the same plants they did, we've just found more efficient ways to extract their active ingredients and put them in a tube. But what have we forgotten? Were there other less common herbs they use for oral health whose benefits we have yet to rediscover? How effective were these herbal rinses at actually changing the composition of oral bacteria? And could we test this by analyzing the DNA of bacteria in calcified plaque from medieval skeletons? And did people have allergies to these herbs? And how would they have dealt with an allergic reaction in the mouth with no antihistamines? Well, number 4, did they really blame a worm for toothaches? For thousands of years, from ancient Sumeria through the Middle Ages and even into the 18th century, the most widely accepted explanation for a toothache was the toothworm. People believed that tooth decay and the associated pain were caused by a tiny worm that burrowed into the tooth, drank its blood, and gnawed on its roots. This theory was not some fringe folk belief. It was the dominant medical and scientific explanation accepted by physicians and peasants alike. The idea made a kind of intuitive sense. A cavity looked like a hole that something had gnawed. The pain was often a throbbing, gnawing sensation, as if something were alive inside the tooth. And sometimes, if you looked closely at an extracted, rotten tooth, the exposed nerve pulp could look like a small white worm. The theory was so pervasive that it appears in the writings of cultures all over the world, from China to Mexico to Europe. In medieval Europe, it was the standard diagnosis. Because the diagnosis was a worm, the treatments were designed to kill or expel it. This led to some of the most bizarre and theatrical medieval dental practices. One of the most common was fumigation, as mentioned earlier. The patient would lean over a bowl of hot coals onto which a practitioner would sprinkle certain substances, most famously the seeds of henbane. The patient would inhale the smoke through a funnel. The henbane fumes, being narcotic, would drug the patient and relieve the pain. The real trick, though, was when the practitioner would have the patient spit into a bowl of water and would secretly drop in the heated henbane seeds, which would uncurl and look like tiny dead worms. The patient, groggy and in less pain, would see the evidence and believe the cure had worked. Other cures were just as strange. You might be told to apply a poultice made of crushed earthworms to your cheek, or to hold a specific kind of caterpillar against the tooth. The logic of sympathetic magic was at play here. Use a worm to fight a worm. Charms and prayers were also directed specifically at the toothworm, commanding it to leave. A manuscript from the 15th century contains a charm against the toothworm that involves invoking the names of the apostles and Christ to banish the pest. The toothworm theory was a dead end that dominated dental thought for millennia. It prevented any real progress in understanding the true cause of decay. As long as everyone was focused on fighting an imaginary creature, they weren't looking at the real culprit's diet, acid, and bacteria. The theory only began to die out in the 18th century with the rise of Enlightenment science and the use of more powerful microscopes. In 1728, Pierre Fauchard, the French physician now considered the father of modern dentistry, published his book, The Surgeon Dentist, in which he explicitly debunked the toothworm theory and correctly identified sugar as a major cause of decay. It was a revolutionary moment, but the old belief in the worm lingered in folk medicine for many years after. It's a powerful reminder of how a wrong but compelling theory can hold back science for centuries. The toothworm was a simple, understandable story that seemed to fit the evidence available to the naked eye. It was much easier to imagine a malevolent little creature than to conceive of a world of invisible microbes producing corrosive acids. But this raises some deep questions about belief and science. How many people saw the toothworm under the power of suggestion from their healer? When a treatment like henbane fumigation seemed to work, did it make even the most skeptical practitioner a true believer in the worm? What other toothworms, plausible but completely wrong theories, might still be lurking in our modern understanding of medicine, waiting to be debunked by a future generation with better tools? Number 3, did leeches on your gums actually help? The foundation of medieval medical theory was the four humors: blood, phlegm, yellow bile, and black bile. Its health was a state of balance, and sickness was caused by an excess or deficiency of one of these fluids. A toothache or swollen gums were often seen as a sign of too much, bad blood collecting in the head. The logical treatment, therefore, was to remove that blood, and one of the primary tools for that job was the leech. The barber surgeons and physicians would use leeches for a huge variety of ailments, and dental problems were no exception. If a patient came in with a painful swollen abscess on their gum, a common treatment was to apply leeches directly to the area. The leeches would attach themselves and begin to feed, their bites being largely painless due to an anesthetic in their saliva. As they fed, they would drain the blood from the swollen area, which was thought to relieve the pressure and remove the corrupt humors that were causing the problem. In a way, this procedure could provide some temporary relief. An abscess is a contained pocket of pus and pressure. For draining, it does relieve the pain. Lancing it with a knife was one option, but applying a leech was seen as a gentler, more natural way to do it. The leech's saliva also contains an anticoagulant called hirudin, which prevents blood from clotting. This would make the area continue to bleed for a while even after the leech was removed, further draining the site. So the patient would likely experience a reduction in the painful throbbing as the pressure was released. The problem was that this didn't treat the source of the infection, which was the dead tooth. It only dealt with the symptom, the abscess, the infection in the jawbone would remain, and the abscess would simply fill up again. More importantly, the mouth is full of bacteria. Applying a leech to the gums, whose bite creates an open wound, was a great way to introduce new infections. The leeches themselves, often kept in jars of stagnant water, could carry their own bacteria. So while it might have provided a few hours of relief, leeching could ultimately make the situation much more dangerous. Leeches were big business in the Middle Ages. There were professional leech collectors who would wade into ponds and let the creatures attach to their own legs to harvest them. They were a standard part of any doctor's medical kit. Their use was not seen as strange or primitive. It was considered standard scientific medical practice based on the best theories of the day. Today, leeches have made a surprising comeback in modern medicine in a field called hematotherapy. They are used in very specific situations, particularly in reconstructive and plastic surgery. When a surgeon reattaches a severed finger or a flap of skin, one of the biggest challenges is getting blood to flow out of the area through the tiny, delicate veins. Arteries are easier to reconnect than veins. If blood flows in but can't get out, the area becomes congested and the tissue can die. In these cases, a sterile, medically raised leech can be applied. It will drain the congested blood, and its anticoagulant saliva will keep the blood flowing, giving the body time to regrow its own venous connections. It's a high-tech use for a very old creature, but nobody is putting them on infected gums anymore. This practice forces us to consider the nature of medical progress. How did physicians balance the observed temporary relief from leeching against the risk of infection they must have seen? Was there ever a debate in the medical community about whether this was a good idea? And could the specific enzymes in leech saliva, beyond the known anticoagulant, have other therapeutic properties that we haven't yet explored for modern dental applications? Number 2, could a healthy tooth from a poor person save yours? This is perhaps the most gruesome and socially unsettling of all medieval dental practices, the tooth transplant. It was an experimental and extreme procedure reserved for the very wealthy. If a rich nobleman or lady lost a prominent front tooth, it was a cosmetic disaster. To fix it, a surgeon could attempt to transplant a tooth from a donor, and the donors were always poor people, desperate for money. The procedure was a frantic race against time. The surgeon would find a suitable donor, often a young person or a soldier, who had healthy teeth and was willing to sell one. The donor and the wealthy recipient would be in the same room. The surgeon would first extract the donor's tooth as quickly and cleanly as possible. Then, he would immediately take this living tooth and try to place it into the fresh, empty socket of the recipient. If it was a good fit, he might try to secure it with wires or threads, splinting it to the neighboring teeth. The hope was that the tissues of the jaw would magically reattach to the new tooth, and it would become a permanent part of the recipient's mouth. This was the brainchild of surgeons like Ambroise Paré, who described the procedure in the 16th century. He claimed to have performed it successfully. The theory was that a living tooth, freshly pulled, had a better chance of taking than a dead tooth made of ivory or bone. It was the most lifelike replacement imaginable because it was, in fact, real. The social ethics of it were horrific. It was a literal transfer of a body part from the poor to the rich. The poor person was left with a gap and the risk of infection, all for a small payment. The rich person was getting a cosmetic fix, also with a massive risk of failure and infection. The vast majority of these transplants would have failed. We now know about the immune system and tissue rejection. The recipient's body would recognize the donor tooth as a foreign object and would launch an immune attack against it. The tooth would never truly integrate. It might stay in place for a few weeks or even months, held in by the initial tight fit and the splinting wires. But eventually, the immune system would destroy the periodontal ligament, the tooth would become loose, and it would fall out. And then there was the staggering risk of disease transmission. Syphilis, for example, was rampant during this period. It's highly likely that diseases were passed from donor to recipient through this intimate exchange of bloody tissue. The procedure was a biological and immunological time bomb, but for a short period it might have looked like a success, giving the wealthy patient their smile back, albeit temporarily. This practice reached its peak in the 18th century with the dentist John Hunter, but its roots are in the late medieval and Renaissance period. It represents the ultimate expression of a mechanical view of the body. They saw the tooth as a simple peg that could be moved from one hole to another. They had no concept of the complex biological systems that would make such a transfer impossible. Today we have dental implants, the modern, successful version of this idea. But an implant is a sterile, biocompatible titanium screw. It's designed to fuse with the jawbone in a process called osseointegration. It's a marvel of material science and biology. It's a world away from taking a tooth from a poor person's mouth and sticking it into a rich person's jaw. The very idea of this procedure leaves us with deeply disturbing questions. How common was this really? How many people were maimed or infected on both sides of the transaction? Are there any skulls and archaeological collections that show the telltale signs of a failed transplant tack, a socket that healed poorly around a tooth that doesn't quite fit? And what did the church and society at large think of this practice of buying and selling body parts for vanity? Number one was a dirty mouth. Actually, a healthier mouth? This is the final and perhaps most challenging question. After exploring all these strange, brutal, and sometimes clever methods of medieval dental hygiene, we have to ask, was all their effort misplaced? Is it possible that in some ways, a medieval mouth, with less cleaning and a different diet, was in a better state of balance than our modern, hyper-clean mouths? This seems counterintuitive, but the science of the microbiome is forcing us to reconsider our relationship with bacteria. The medieval diet, as we've seen, was low in sugar and high in fiber and roughage. This created a certain kind of environment in the mouth. The bacteria that thrive on sugar and produce huge amounts of enamel-destroying acid, like Streptococcus mutans, would have had a much harder time dominating the ecosystem. The oral microbiome of a medieval person was likely far more diverse and stable than ours. They had a complex community of bacteria, fungi, and viruses that had co-evolved with humans over thousands of years on a low-sugar diet. Our modern diet, high in sugar and processed carbohydrates, has completely changed the game. It has created an environment where acid-loving, cavity-causing bacteria can flourish, crowding out other, more benign species. Our obsession with cleanliness might also be part of the problem. We use powerful antiseptic mouthwashes that kill 99.9% of germs. But which germs are we killing? We are indiscriminately wiping out the entire microbial community, the good with the bad. This can disrupt the natural balance and create an opportunity for the most resilient and often most harmful bacteria to grow back first and take over. A 2014 study led by researchers at the University of Adelaide analyzed the calcified plaque dental calculus from ancient skeletons and compared it to modern samples. They found that the microbial diversity in the ancient mouths was far greater than in modern mouths. The shift happened around the time of the Industrial Revolution, when processed flour and sugar became widely available. The lead author, Professor Alan Cooper, noted that the modern mouth is in a state of permanent disease. So, while a medieval person didn't have fresh, minty breath and might have had significant plaque buildup, that plaque represented a more balanced, ancient ecosystem. They suffered from different problems, extreme tooth wear, abscesses from that wear, and gum disease from plaque buildup. But they had far fewer cavities. They weren't constantly fighting a war against an oral environment thrown into chaos by sugar. Their problems were more mechanical and inflammatory, while ours are more chemical and decay-oriented. This doesn't mean we should stop brushing our teeth, but it does mean that the medieval experience holds a crucial lesson. Oral health is not just about sterility, it's about balance. The future of dentistry may be less about killing all bacteria and more about promoting a healthy, diverse microbiome. We might see the development of probiotic toothpastes and mouthwashes that introduce beneficial bacteria to outcompete the bad ones. We may learn to garden our oral microbiome rather than carpet bombing it. The people of the Middle Ages lived in this older, more balanced microbial world by default. They didn't understand it. They tried to clean their teeth with urine, acid, and charcoal. They tried to kill imaginary worms and bargain with saints. But all the while, their diet was providing them with a hidden, powerful form of protection that they were completely unaware of. This leaves us with the biggest questions of all. What specific species of good bacteria have we lost from our mouths, and could reintroducing them revolutionize dental health? Is our modern obsession with perfect white teeth and sterile mouths actually a long-term mistake, creating a new set of dental diseases that ancient people never had to face? And ultimately, what can we learn from the dirt and decay of the past to build a healthier future for our teeth?